Good afternoon, everyone, and welcome to this webinar on the U.S. Early Years Climate Action Plan. I'm Joe Waters, the co-founder and CEO of Capita and a 2021 Aspen Ascend Fellow. Delighted to collaborate with Ascend at the Aspen Institute to bring this work to all of you this afternoon. I'm joined today by our panelists and colleagues, Atiya Weiss, also a 2021 Aspen Institute Ascend Fellow, Dr. Leah Austin, Executive Director of the National Black Child Development Institute, and Patricia Mendoza, the parent of a young child whom I met at the end of September when I visited Educare in Silicon Valley in San Jose, California. So great to be with you all today. Our roadmap for this afternoon's webinar is that I will present an overview of the U.S. Early Years Climate Action Plan, and then we will turn to our panel discussion. We'd be delighted as well to know where you're joining us from, so please put your name and where you're calling from in the chat. With that, I'd like to introduce the U.S. Early Years Climate Action Plan. Climate change is a context. It's not just an issue. It's an era. We're living in the era of climate disruption. And that is the starting point for the work of the U.S. Early Years Climate Action Task Force. Climate change is also a risk multiplier for already vulnerable communities and a risk to our shared North Star of intergenerational prosperity and well-being. The U.S. Early Years Climate Action Task Force was convened in June of 2022, a collaboration between Capita and This is Planet Ed at the Aspen Institute, recognizing that in the earliest stages of life, from before birth through age 8, children develop rapidly and have a distinct biology that makes them uniquely sensitive to their environments and exposures. And in fact, 90% of the global disease burden of climate change is borne already by young children. This is not just a future challenge that we face. It is a challenge to the health, well-being, education, and flourishing of our children and their families today. Young children's experiences and the places they spend their time shape their path to adulthood. Climate change is intensifying, and that makes it harder to provide the nurturing places and experiences that help children become healthy and resilient adults. When communities are set up to support those healthy experiences and places, those communities themselves become healthy and resilient. Healthy, resilient children are the foundation for healthy, resilient communities, and frankly, the most cost-effective way to build the resilience and adaptive capacity that we will need as communities and societies to withstand climate disruption now and in the future is by focusing on our youngest children and by focusing on investing in our youngest children. Caring for our children and for our planet are inextricably linked. As I said, this is investing in our youngest children is a cost-effective approach to building the resilience and adaptive capacity that all societies around the world will need now and into the future. And so in the fall of 2022, the Early Years Climate Action Task Force, 20 early years leaders, climate leaders, researchers, medical professionals, parents, philanthropists, and more came together to recognize the urgency of climate change and the opportunity for those committed to the early years, those serving our youngest children and families, to partner with those working on climate action to create a more sustainable, resilient, and equitable society. Over the last year, Next slide, Michael, if you don't mind. Over the last year, the task force held a listening tour to learn about the impacts of climate change on young children, as well as the unique needs of and opportunities to support young children, their families, and the programs that serve them in a changing climate. We heard from caregivers, providers, doctors, researchers, and community leaders from across the country. And of course, we heard from parents. We were inspired by their leadership, advocacy, and action, and we have grounded this action plan in what we have learned. Dr. Austin was a member of that task force, and I'm hopeful that later on she'll be able to share some of the insights she gleaned from the listening sessions. But I just wanted to share one example. We heard from an early years provider, a woman named Lois Kedrick, who at the time was also president of the Florida Family Home Child Care Association. Lois shared with us a remarkable story of her own challenges in withstanding Hurricane Ian, the challenges she faced in dealing with insurance companies and FEMA and so forth to get her business back up and running, and of course, her home back operational to support that business. But one of the things that Lois shared with us that I thought was just remarkable and speaks to how, the leadership on this issue that is already out there across the country. She told us that she needed to get her business back up and running, not within just a couple of days, not so much for her own income, to support her own income, but because she felt a sense of responsibility to her community, because the parents of so many of the children in her care were first responders. She recognized, and we saw at the task force level, how important early years providers are to not only the resilience and infrastructure of our communities, but how important that infrastructure is to rebuilding after disaster when one hits. In the United States, we have more than 33 million children who are under the age of 8. And these were the children. This was the population that was front and center as we undertook the work of the U.S. Early Years Climate Action Task Force. We looked, for example, too, in collaboration with Harvard Graduate School of Education, some folks up there, we looked at the 40 largest cities around the United States, at their climate action plans, if they had one. We found that 34 of the 40 had adopted a climate action plan. Only 16 mentioned the health and well-being of young children. Bear in mind, this is the population that bears 90% of the disease burden of climate change globally, so disproportionately impacted by the hazards of climate disruption. But only 5 of those cities noted young children as a population with distinct needs. So what we found is that there are often places around the country that are talking about the need to mitigate climate change, to adapt to climate change, to ensure a healthy, safe, and clean future for our young children. But fewer are speaking about the need to create a healthy, safe, clean now for our young children and to protect our young children and their development from the negative impacts of climate disruption. So what were some of the recommendations in the Early Years Climate Action Plan? Ensuring healthy development that builds resilience in children is work that cannot be done in isolation. Instead, it is an opportunity for collaboration across families, child and family-facing programs, policymakers at all levels of government, businesses, nonprofits, the faith community, philanthropy, advocacy, and more. And next slide, if you don't mind, Michael. In the action plan, we make recommendations to support collaboration from policymakers, early years providers, business, philanthropy, and researchers to effectively support children and families, child and family-facing programs, and communities. And I want to say here, too, that the task force was very clear and considered it important to emphasize that it is not the responsibility of early years providers to take on solving climate change, But we all have to recognize that climate change is the context in which we are all going to be doing our work. And as such, we need to reimagine our systems, our programs, our infrastructure, our facilities, frankly, for that new era. But it is not the intention of this task force to suggest that early years providers need to now take on solving climate change in addition to all of their other work, which is so important, but often so under-resourced. So what can early years providers do? There are a couple of recommendations here that I just want to highlight. And, one of them is over here around warnings related to climate risks, and also the need to share information with parents. We know that early years providers, and here we defined early years providers pretty broadly. Early years providers are among, whether they're pediatricians or childcare providers, they're among the most trusted partners to parents in their communities, if not the most trusted partners to parents in communities. And so the need for climate risk screenings, the ability to share information, we know that early years providers do not yet have the resources at their disposal to share good information with parents and so forth. But we know that that's also building on the trust that already exists in communities with early years providers. That's a tremendous opportunity for the future. Sharing warnings about extreme climate events, for example, is another way that early years providers, again, whether they be pediatricians or childcare providers or so forth, can support parents and families with young children in the context of a changing climate. I heard a story last summer when the Canadian wildfires were so negatively impacting air quality in New York City, about how much, we have a colleague who's based in Brooklyn, how valued and how valuable the warnings, the information provided by text message, WhatsApp groups, and so forth from the medical community was to parents in that context. That need is only going to grow, and it's the type of thing that I think can be incorporated into existing programs fairly easily. There are plenty of examples in the action plan, many more examples. We encourage you to look at those, but I also want to look at what local governments can do. Although federal and state governments can create enabling conditions, local government drives implementation and climate action within communities large and small across the country. Local governments can integrate the perspectives of young children, their families, and those who support them in planning and taking action on climate change. Local governments can incorporate their early years into climate planning and action by building authentic connections with young children and their families, especially those who have been historically marginalized. Parents with young children, families with young children, caregivers who support families with young children need to be incorporated by local government into climate resilience planning processes. This is just one simple, concrete thing that local governments can do to make sure that this disproportionately impacted population is included in their climate action planning at the local level. We need to increase access to family-focused and climate-resilient outdoor spaces. And when I was in San Jose at the end of September, this is something that I heard loud and clear from Patricia and from the other parents who participated in that conversation with me, for which I am very grateful. Loudly and clearly, I heard that access to healthy, safe, and clean outdoor space in the context of poor air quality, in the context of extreme heat, is essential, not only for the healthy development of young children, but for the well-being of us all. And those healthy, safe, clean outdoor spaces have co-benefits for the broader community. For example, in providing cooling and shade that we all benefit from, whether we have young children or not. But in so many communities across the country, particularly in big cities, particularly in places that are vulnerable to climate disruption, these spaces are harder to come by. We need to also advance strategies to support early years providers in ensuring safe, healthy, reliable, and high quality services to children and families in a changing climate. And again, something that the Early Years Climate Action Task Force heard that was quite profound was the example of the Birthmark Doula Collective in New Orleans that is supporting pregnant and lactating people in the face of climate disruption, particularly in Louisiana, resulting from hurricanes and other storms. And it was something that I frankly had never thought about. But how do you ensure continuity for a nursing parent when they have to evacuate in a hurricane? What are the resources in evacuation centers to ensure that a parent can continue to nurse, refrigerate, and so forth? So these are the types of things that we saw that are already happening, we heard are already happening across the country, that were not only deeply moving, but inform the recommendations. And finally, we need to build the ability of neighborhoods to support young children and families by expanding access to climate resilience hubs, community aid, and social connectivity. These are just overviews. And again, there are recommendations for federal government in the action plan, for philanthropy, for researchers, the business community, and so forth. Encourage you to learn more at earlyyearsclimateplan.us. And now I am delighted to turn things over to my friend and colleague, Atiya Weiss, who's the executive director of the Burke Foundation. The Burke Foundation being one of the supporters of the U.S. Early Years Climate Action Task Force and this plan to moderate our conversation. Atiya.
Thank you so much, Joe, and thank you to my fellow panelists. Good afternoon, everyone, and good morning to our West Coasters. I'm so grateful to be part of today's discussion, and thank you so much for including me in this conversation. As Joe mentioned, at the Burke Foundation, our focus is on helping children and families thrive in the first 1,000 days from pregnancy through age 2. And one of the ways that we do that is to identify and look for ways to relieve the major stressors on families. And Joe, thanks in large part to your recent groundbreaking report, climate is increasingly part of our thinking. When we look at everything from maternal and infant health, childcare, and early relational health, climate risks and resilience must be considered. And this is especially true in marginalized communities that are highly vulnerable in the face of climate change and major weather events. And I was so moved to read your report and to read in the introduction, which I'm going to quote from: children, despite being least responsible for climate change, will live with its impacts for their entire lives. They have a fundamental right to a clean, healthy, and sustainable environment. And what I took from that is that we owe it to our children to protect this right and lay the foundation for a more resilient and just society for generations to come. So thank you for putting this terrific report together. It's chock full of great actionable recommendations for lots of different groups and stakeholders. And I'm really excited today to really have this conversation with Patricia and Dr. Austin and you, Joe. And so I'll just get started to hear from them. Patricia, you were able to meet Joe at that conference in California. And I know you care a lot about green spaces. So I'd love to hear from you to talk about what do you think are some of the major barriers to providing access to green spaces and play areas for children? Why is this so important for children's health?
Hi, thank you for having me today. Yes, my name is Patricia, and I'm a mother of 3. I have 8-year-olds, a 5-year-old, and a 2-year-old, which Joe met. And it is crucial to have access and quality when it comes to these open spaces. And so those are the major barriers that I can think of, and just speaking with other members of the community and hearing what our different neighborhood coalitions have to say. Access is a huge one. If we have to get in our vehicles and drive 30 minutes to get to a clean area, a clean park for kids to play, then it's not realistic. It's not realistic for parents to be able to take that walk around the block if it's not safe, if it's not clean. We have bodies of water that are creeks, or they're supposed to be open spaces, but they're toxic. We can't get near them. And so if we're not caring for these spaces, if we as parents and community members don't instill that love and respect for our nature and the importance of having these spaces for our little ones, when they grow up as adults, what are they gonna believe that we did for them, and what are they going to believe that's important in their communities and their neighborhoods. And so we definitely want to prioritize that, and again, for the quality part, the component of it, when we do have parks, they're not safe. They're not, if it's really hot, especially from California, so far in our larger cities, we look for these spaces as respite in the summer. And so if there aren't any benches or trees with canopies that are established, it's not realistic to take our kids to a burning playground. And so they become useless. And so we want to take advantage of the access so that it's nearby. We don't have to pay for parking. It's accessible to everybody, and the quality of what is available and realistically to the community. And of course, the benefits are outstanding, right? So there's mental health benefits for our kiddos. Not only, it was clear during the pandemic, right? Not only the therapeutic part of it, and they get to play with other kids and socialize, and just connect to nature, but also the physical components of it. And realistically, unfortunately, especially here in the US, obesity with our kids, it keeps growing, right? Diabetes is upticking. Of course, every year we see the terrible statistics of it. And so if we don't provide these spaces for our families to go and enjoy and get our kiddos moving and connecting with nature, we really can't blame them or blame parents when it's not out there. It's not a resource that's available.
Thank you, Patricia, and thank you for everything you're doing for your family and as an advocate on these issues. Really appreciate it. And for those that are listening in, please feel free to put your questions in the chat as well. We have plenty of time to get to them. Dr. Austin, in your role at the National Black Child Development Institute, would love to hear about what you're thinking about in terms of climate disruption and specifically its effect on Black children in America.
Absolutely. Well, first, thanks for having me. Really, important conversation, and so glad to be both a part of today's webinar and also to be a part of the task force. It was a really incredible learning opportunity, and happy to share more of that as we go through the conversation. So let me just share a few things. So one, the National Black Child Development Institute is the only national organization committed solely to the creation of an equitable, just, and joyful future for Black children and families. Climate disruption, of course, is a critical issue that must be addressed to ensure that all children flourish, because we know that it does impact everyone. However, the unfortunate truth is that it does not impact everyone equally. Through no fault of their own, Black children are most vulnerable to the negative impacts of climate change and disruption, which have long-term consequences for their health, for their education, and their overall well-being. So a few examples. One, poor drinking water quality. We know that this is linked to the transmission of nearly 50 diseases. It can cause significant dehydration in young children during a critical time in their development. And there are links between dehydration and both physical and brain development. Air pollution has also been linked to asthma, which is more prevalent in Black children. And this is due to racist policies and practices like putting factories and sewer management facilities in lower income and specifically Black communities. Or I'm in Atlanta, so building highways that literally cut through Black neighborhoods. So just imagine a 5-year-old, a 6-year-old out playing. They're not just playing in their backyard and trying to just have a joyful, wonderful time, they're literally breathing dirty, toxic air as they are outside. And then extreme heat. Extreme heat can cause negative impacts on social and academic outcomes for students. We know that many schools and early learning centers that are in urban and rural communities and that primarily serve Black and Brown students are often least likely to have the proper air conditioning and ventilation systems that they need. And we know, we can all probably resonate and think about when you are in an extremely hot space, it makes it really hard to concentrate. It often makes you kind of agitated. You don't have, the patience that you think you should have or you would have. And we know that for students to learn, they need to be able to do this, that. They need to be able to concentrate. They need to be able to play with their colleagues, other children. And if they can't do that, if they're in an extremely hot space. We also know, and it's been noted, that this year has been the hottest year on record, right, for extreme heat. And that's kept children from being able to play outside. And play is not just something children do, right? Play is absolutely, it's more than critical. It's literally how they learn. It's where they develop physically. It's how they build social connections. And so if they're not able to play outside, we are losing that development during this really critical phase of their lives. So at the National Black Child Development Institute, what we're doing is we're really working to lead a movement to shed light on the specific ways that climate change and disruption and environmental injustice affects Black children and their families. And we're working to mobilize parents, educators, and really all advocates to demand policies and practices that, quite frankly, builds a world that makes flourishing easier. Like, it shouldn't be so hard for children to flourish. We should be building a world that makes flourishing easier. A world where every Black child breathes clean air and drinks clean water in a climate where they can thrive is one of our 8 essential outcomes for Black child development. I'd also just like to share and state that communities of color are in fact leading the way when it comes to being concerned about climate and how it's impacting our children and our families. Data that Capita actually shared with the commission from the Think of Children survey stated that 81% of Black and 83% of Latinx respondents were very or somewhat concerned that climate disruption would impact their children in their lifetime, compared to about 70% of white respondents. And this aligns with a recent Yale study that shows about half of Americans, so 49%, think that global warming harms some groups in the United States more than others. And in fact, when prompted, nearly half of Americans think global warming harms lower income people more than it harms wealthier people. And lastly, about 1/3 of Americans think that global warming harms people of color more than it harms white people. And about the same percentage, about 34%, say that a history of racist policies makes people of color more likely than white people to be harmed by global warming. So this data shows us that while we still have work to do, and we talked about this as a part of the task force, there's still work to do to even create a shared understanding of climate change and disruption. We also have a real opportunity to advance climate equity and justice by centering and listening to the communities that are being most impacted, and in fact have solutions and strategies and ways of being that can really have transformational impact if we're both centering them and listening to these folks.
Thank you so much, Dr. Austin. That's incredibly helpful, and really appreciate your leadership on this topic. Joe, our friend, Dr. Alicia Musso, who's the vice president of the Oglala Sioux tribe, wasn't able to join us today, but I know that she was an incredibly valuable member of your task force. Can you share a little bit about her perspectives from the Indigenous communities as it influenced your report and the work you've been doing?
Well, in addition to Alicia's participation on the task force, we also heard from Indigenous people around the United States, I think it's important to remember Indigenous people occupy only 20% of the earth, yet they care for 80% of the remaining environmental biodiversity on the planet. We also need to recognize the importance of not only including Indigenous voices at the table, but actively learning with and from our Indigenous brothers and sisters to embrace ways of knowing that are, frankly, wise in the ways of caring for the earth, and as a stark contrast to the ways of knowing that we see in what we call weird Western educated, industrialized, rich democratic societies. And so I think it's really important to recognize not only that Indigenous people are at the table, they're part of the decision-making process, but that we're all learning with and from Indigenous ways of knowing in tackling some of the most pressing issues faced by people and planet.
Really appreciate how much work went into over the last year and a half, getting so many different voices and perspectives included in the report and really centering equity in it. Maybe going back to Patricia, you have 3 kids, and what are you doing right? Is the community listening? Are your schools listening, on the issue of green spaces, and kind of safe, affordable places to live with your kids?
Yeah, it's difficult. Like Dr. Austin mentioned, it's ongoing work. It's ongoing work. I think everybody's heart is in the right place, but when it comes to really ensuring that these open recreational spaces are there for families, it comes down to the money, right? And so our school districts are supportive, but where's the funding? And so what we do as community members, or where I encourage other neighborhood associations that I'm involved in, is we need to invite ourselves to the table. We can't wait for our city leaders to come to us and say, what would you like in this development? As soon as we see a development of a property either being demolished or a project being proposed, we want a seat at the table. We start connecting with each other and prioritizing, what do we need in this neighborhood? What do we need as community members? Because unfortunately, when there's developments, they're not thought of as, what open space can we provide this neighborhood? It's more of, well, how can we get the biggest bang for our buck? And it comes down to housing, especially in the Bay Area and the big, larger cities all over the nation. Housing is a big one. Recreational space. Commercial space. That's what generates money. Open spaces don't generate money. And so we really advocate for, we want green spaces. We want an area where either a soccer field or a playground incorporated for the community, not a gated community, for open for everybody. And so we really, really try to engage with our local leaders, engage with our council members, and even with the developers, whoever will listen to us. We're there as soon as we can get those meetings and really connect and let them know, you're building something for the neighborhood. We live here. We're the ones who are going to walk past it or drive past it and live with it. And so listen to us. This is what we need. This is what the community needs. And that way kind of try to persuade where the money is coming from, where the decisions are coming from, to kind of get a little amenities that will go a long way. Because otherwise, if we as parents and if we as community members don't speak up and don't engage and make those contacts, then whoever's developing will come right through and develop what they see fit, and they leave because they don't live here, right? And so they're fine developing whatever they think is needed or will generate funds. And so I think the most important thing that I do as a parent, and I see other parents and community members do, is inviting ourselves to those meetings, inviting ourselves to those tables where the decisions are being made.
Yeah, really appreciate that proactivity. If you're not invited, get yourself there. And also the putting that value on what you're talking about, valuing this is a really important aspect of development of our schools, of our communities as well. Thank you. Dr. Austin, how are you seeing, as you're working with those that are most, closest to these issues, thinking about the families you work with, what are some of the approaches that they're taking in their communities?
Yeah, absolutely. So one, I love this statement, and I think it rings true when I think about we have an affiliate network of 26 affiliates across the country. So when I think about the work they're doing, it resonates very much with me. This notion, this actual necessity to not only invite yourself to the table, but to create in many ways your own tables, right? And to be setting those tables and inviting folks to your table. And so we're seeing a lot of that, where folks are putting together local collective action tables and really beginning to set the stage and set the conversation in different ways, as opposed to what sometimes feels like we have to be invited, but they're really sort of taking that proactive stance that was mentioned. So I think that we're definitely seeing that. It's interesting, something that I've been thinking a lot about that I learned when I was part of the task force, and we've been talking to our affiliate network about when it comes to this issue is, and Joe talked about it a bit with the focus of the task force really wanting to be intentional to say, we're not saying now, early childhood provider, this is also your job and your work to do, but that it is really the context that we're all working in, was this notion of climate anxiety, and really being mindful and working in such a way that we all understand the massive nature of the issues, right? And the massive nature of the context that we are living, working, and playing in. And how do we also talk about it and mobilize people in such a way that it doesn't feel like or become one more stressor, one more thing to take on. And so this idea of really mitigating climate anxiety in people's lives was something that really stuck with me. And so as we've been working with our network, we've been just really balancing that. Like, how do you make sure, someone has put in the chat, like, urgent action cannot be avoided. And that is true. And so how do we do that and also recognize just the real lives that folks are living? And again, this is a context that we're living and working and playing in, but we've got to be able to sort of manage both. So that's definitely something that we're thinking lots about.
I think that makes a lot of sense. There's a lot of challenges on people's plates these days. So how do we value this and also make it part of the fabric of everything we do? So really appreciate that. I work with a lot of community doulas, and that often they're considered the panacea for maternal mortality. They're very powerful. They're really important, but we can't put the whole burden of our systems on them. So I really appreciate what we're thinking about around climate change. Joe, I'd love to hear from you. I know you care a lot about early relational health. Where do you see this work fitting into can you define early relational health to the audience? Where do you see this fitting in with it?
Yeah, so safe, stable, nurturing relationships between children and loving adults are essential to healthy growth and development. And they also shield our young children from traumas and stressors that can negatively impact their development in those earliest years of life. So I really see early relational health promotion as an essential strategy for supporting the well-being of our children in the context of climate disruption, but also building this individual and collective resilience that we're all going to need, that we all need now and are going to need in the future as a result of the planetary challenges that we face. And so, concretely, what does that mean? There are some recommendations in the action plan around the importance of promoting early relational health. I think it just adds further further impetus to the work that David Willis and Einhorn Collaborative and the Burke Foundation and others are doing to really ensure that the promotion of safe, stable, and nurturing relationships is standard of care in general pediatrics. We need, for example, more doulas, because we know that doulas and doula care is essential to promoting those safe, stable, nurturing relationships at, even before birth, and certainly in the very earliest days after a child is born. So, all of those efforts, which we might not typically see as climate related efforts, I think we need to see through a new prism of this is about in part addressing climate disruption and the impacts of climate disruption on young children. We also think at Capita that as a result, the billions and frankly trillions of dollars that are going into climate adaptation and resilience, and will over the next decades going into climate adaptation and resilience around the world, more of that needs to be directed not only at young children, but at these resilience promoting activities, right? That like we see in doula care, for example. And so, we'd like to see right now less than 3% of global climate finance is directed at the needs of children or child and family serving systems. We need to up that percentage. Our colleagues at UNICEF are calling for 50% of all adaptation finance globally being directed at young children and child and family serving systems. So, we need to connect the dots between these sort of resilience promoting efforts, like promoting early relational health, the finance that is being spent to build adaptive capacity and resilience across societies, because right now it's not there. And early relational health, I love to talk about it. And I think this just gives us a new way, a new frame, and frankly, a new set of audiences to talk with about early relational health.
Thank you, Joe. And I know, so interesting to hear UNICEF making that call. And I'm thinking about kind of a lot of international stakeholders right now. I know you're on your way. You're probably packed up to go to Dubai, tomorrow.
I wish I was backed.
You will get back by the time your flight goes off. But you're heading out. So maybe you want to share what you're doing at COP over the next 2 weeks, which sounds really exciting.
Yeah, so we're collaborating directly with the Abu Dhabi Early Childhood Authority. Of course, COP is being hosted in the United Arab Emirates. And our colleagues in Abu Dhabi, which of course is the capital of the Emirates, have made investing in early childhood development a huge priority for the Emirate of Abu Dhabi, and they're connecting the dots and using COP as an opportunity to connect the dots more explicitly. So we're co-convening 5 sessions over the next week and a half with the Early Childhood Authority in the Education Pavilion at COP, hosted by the Ministry of Education for UAE, to really raise awareness and understanding about just the critical importance of investing in our youngest children and nurturing care and so forth as a strategy for building the adaptive capacity that we all need in the future and now and into the future. So that's the message that we're taking to COP, and all of those sessions, if you're interested in following along, are at capita.org/events. And we're really grateful to the authorities in Abu Dhabi and in UAE for hosting us and allowing us to bring this work focused on young children to COP.
Great. And Joe, you have a number of audiences in your report that you've got recommendations for. Where are you finding that you're getting the most traction right now for the recommendations?
Well, there's a lot of enthusiasm for this action plan. In fact, just in the last 20 minutes, as I've been monitoring my email, as we've sat here on this webinar, I've gotten an invitation from a community coalition in California to come speak about it. So there's a lot of enthusiasm across all of those audiences.
Yeah.
However, I will say that people at the local level we're finding a lot of traction from folks locally who want to connect the dots in their community between their early years stakeholders, the health stakeholders, healthcare community, and local officials, mayors, chief sustainability officers, chief resilience officers, and so forth, who have a level of responsibility for ensuring resilient communities. And so, I was actually just in Atlanta, where Dr. Austin is, in a conversation with hosted by National League of Cities with Chandra Farley, who's the chief sustainability officer for the city of Atlanta, and she's talking about how Atlanta needs to embrace the recommendations in the action plan, and that's exciting. And frankly, I don't think we would have heard a chief sustainability officer a year and a half, 2 years ago at a city level talking about the critical importance of our youngest children, our early care and education system, our child health system, and so forth, incorporated into their work in sustainability and climate resilience. So there's a lot of enthusiasm across the board, but we're seeing particular energy from cities, county governments, and other local stakeholders around the country. And I will say too, last night I was on a webinar and talking with some folks about this, with NAFCC and NACI, National Association for the Education of Young Children. And we had 3 providers from Washington State, California, and Texas. And they all have their own stories in those 3 states of how climate-related disruption has already negatively impacted their programs, their children, and their families' lives. And so, we actually are finding we don't have to sell anyone on this. We just need to connect the dots with solutions.
Yeah, I really appreciate that. I live in New Jersey, and so it was, one of the first times when we were dealing with the the impact of the Canadian wildfires. And so I was, sitting down with my superintendent, and I asked her, I said, what is keeping you up at night right now? And she said, climate change. We don't have enough mitigation strategies. We don't know what to do. So I think really appreciate, I think that is where so many of our officials are, our childcare providers, our medical professionals. I think they're very eager and excited to connect the dots on climate and kids, and really appreciate how much you are centering children through your new report. I want to thank everyone for this wonderful panel today. Thank you, Dr. Austin. Thank you, Patricia. Thank you, Joe, so much for the opportunity. I'm very happy to hand it over to Laura from This is Planet Ed to close us out.
Hi, thank you all so much. My name is Laura Schifter. I'm a senior fellow with the Aspen Institute, staff lead for This is Planet Ed. First of all, I just want to express my gratitude for this excellent panel and conversation. Really appreciate all the leadership and work in this field from everyone at this panel. And also just want to express my gratitude to be able to work with Capita and all of our task force members on the Early Years Climate Action Report, which we know can make a big difference in the lives of children for generations to come. I also just want to share a little bit, what really brought me to start working on climate change was the fact that I'm a mom. I'm a mom of 3 young children. And I experienced my own climate moment reading one of the IPCC reports and realizing for the first time, the urgency with which we have to address climate change and the way that climate change is going to shape the lives of young people, both now and into the future. And this is an issue for the world's children across the board. And we all have a responsibility and an opportunity to help children live well in a changing climate. And what's really outlined through this action plan are the opportunities to advance solutions to do that. And there are technical solutions that need to happen to ensure healthy and sustainable environments for young people to thrive. And there are solutions that we can all advance today. I think one solution of hope that I think is so powerful coming from stories around heat waves is, a lot of deaths that happen in regards to heat waves are people living alone. And one of the biggest strategies that you can do to combat loneliness is a policy of checking on your neighbors. And so the idea that there are solutions that we need to advance that are technical, and there are solutions that we need to advance that are going to require us to live better in community is really important for us to all take forward and ensure that we create a sustainable, resilient future where all young children can thrive. So I just want to thank you all for doing all the work that you are going to be doing in whatever capacity to ensure that sustainable, resilient future for all children, and just really appreciate the opportunity to be with you all today.
Great. Thank you, Laura. And with that, Atiya, thank you for moderating the panel, Leah for being here, Patricia as well. And I think we're adjourned. Grateful to Ascend for hosting us too. Bye-bye, everyone.